Aesthetic breast surgery is about changing the volume and shape of a breast in proportional to the body and the requirement of the lady using different surgical techniques. The requirement can be different, and therefore the surgery should be tailored to each individual. We can enlarge the breast, and the most common technique is using a silicone implant that can alter the shape and size of the breast depending on the requirement of the patients. There are other ladies who find that they need to reduce the size of the breast, and we can remove skin and tissue and tighten the breast at the same time. Other cases can be different. For instance, there's ladies who are born with different shape and size of breast, and we can improve the symmetry by using all the techniques above. Some ladies are born with shape and narrowing of the breast due to congenital issues. In those cases, the surgery may require to change the shape on the slower stage, and therefore you may need 1 or 2 surgeries to do this job properly. Aesthetic breast surgery is about improving the shape and volume of the breast in proportional to the body. To increase the volume, the most common technique is by using a silicone implant. This is being inserted behind the breast through a small incision at the inframammary fold. It's normally about 5 centimeters, and the implant is being placed either behind or in front of the muscles. The variations really depend on the requirements of the patients and the shape of the implant. Other patients may require a reduction in the size of the breast, or they would prefer an uplift after having children or gravitational changes. Both techniques involve repositioning the nipple into high positions, removing some excess skin and tightening of the breast. Of course, in breast reductions, some tissue will be removed. In general, breast augmentation surgery is not very painful. Most patients complain about discomfort, and that is actually related to the stretching of the skin and the tissue itself. There is some pain where the scar is being done and related to the swelling, and it's normally worse on the next day. The most important thing is about taking your painkiller for the next few days afterwards on a regular basis. If you can do that, the pain is well controlled and it will improve in a very short period of time. The appearance of a breast after augmentation surgery is proportional to the amount of tissue the patient starts off with and the size of the implant being put in. If the patient already have a reasonable amount of tissue and only a small increment, then the appearance will remain very natural. However, if a lady starts off with relatively small amount of tissue but have a relatively large implant inserted into the breast, the appearance will take on the shape of the implant and unfortunately will be starting to look unnatural. It will take about 6 weeks for the body to fully recover from any type of surgery. The most important thing about breast surgery afterwards is not to do too much heavy lifting and not to put the arms above the 90-degree level, which allow your muscle to relax and the swelling to go down. Most commonly, patients ask me, can they go back to the gym? They can if they want to do some lower body exercise around 4 to 5 weeks time, of which is such as stationary bike. Therefore, there's no excessive movement from the upper limb. But to fully recover, you do need 6 weeks for that.